Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am joined again by the amazing and wonderful Emily Cahill. Emily, thank you for joining us. As I get bits of broccoli out of my teeth. If you haven't met Emily before, there's plenty of videos on our YouTube channel with Emily, so you can go and have a look. But Emily is our resident naturopath. She writes the majority of our articles on our Facebook page and on our website. She's a registered nurse, and she works in a great big hospital here in Melbourne, Australia, in the cardiovascular unit. So she's working a lot with cardiovascular disease and all associated diseases that go along with that, including kidney disease. She's also a qualified naturopath and has been practicing for a while. And she actually has a special interest, obviously, in kidneys, but also cancer. And that brings us to our topic today. We wanted to talk about kidney cancer. And it's not something we see a lot of in our kidney coach community. I think when people are diagnosed with cancer, and Emily, I'll get you to speak to this, people go down a very different route with their treatment and how they're looking at things. But there's definitely things that we know from a kidney standpoint and just general health that you can do to promote your health, and concurrent treatments that may be really effective if you have been diagnosed with kidney cancer. So, Emily, I'm going to hand it over to you. Maybe, and I say that, and that's a general handover, but maybe let's just start with kidney cancer, because it's not one of the more common cancers. And when I say that, it's probably not a cancer that people have a good understanding of what happens to the kidneys in kidney cancer. So maybe let's start with that, of just the pathophysiology of the disease and what kidney cancer actually looks like versus chronic kidney disease.
Sure. So kidney cancer has actually been on the rise, sort of similar to kidney disease. Sort of since the 1970s, the incidence of kidney cancer has been increasing, which may partly be because we are better at picking it up, but also because a lot of the risk factors are, sort of, I guess, lifestyle type things as well. So, I guess going back to what cancer is. So cancer's when cells in the body have become abnormal for some reason, and they start to grow and multiply too quickly and sort of out of control. So our body doesn't have the same checks and balances that it usually would have to keep control of these cells. And they also don't act on their own. So cancer cells also enlist, our other body cells, genes and proteins and things like that in the body to help them to continue to grow and divide. So it's, I guess, a little bit similar to kidney disease. Symptoms or signs of symptoms of kidney cancer don't often come up until the cancer is sort of a little bit larger and a bit sort of further along, because some of them are quite vague. And they're also actually quite similar, to signs and symptoms of kidney disease. So things like having blood in your urine, having pain on your back, sort of on one side. Sometimes people can get a sort of a bit of a mass or a lump on one side of their back, loss of weight, loss of appetite, fever. That one's obviously different from kidney disease, and anemia. So I'll often see that people are diagnosed with kidney cancer often actually when they're getting investigations into something completely different. So they've got something else going on and they've had a scan and it's been picked up then, rather than, having signs and symptoms and going in and sort of getting those investigated.
Yeah, that's so very true, isn't it? With cancers in general, not often, but they can be one of those things that get picked up as a anomaly for other things. And I definitely know that's the case with kidney cancer, because I guess a lot of people aren't thinking kidney cancer with those sort of, and they're quite vague symptoms really, a little bit of lower back pain. Unless you've got the blood in the urine, the rest could just be, oh, I've got a bit of a fever, I'm a bit fluey, I'm just a bit achy. I guess no one's going to be thinking of kidney cancer. So of all the cancers, where does kidney cancer rank as far as, how popular is the wrong word, but how common it is? So I guess breast cancer and those sort of things sit right up the top. Where does kidney cancer sit on that list of cancers?
Yeah, it's definitely, it's not one of the I guess, more common cancers, breast cancer, prostate cancer, lung cancer, which is sort of becoming more common, are all certainly more common. I don't know exactly where it sits in sort of prevalence, but yeah, it is certainly further down, but does seem to be becoming more common.
Okay. And why do you, and I know you mentioned lifestyle, do you think it's the lifestyle factors that are making kidney cancer more common? Do you think it's an environmental issue?
Yeah, I think definitely partly environmental. I guess the thing we've got to remember with the kidneys is that they're the filtering units of the body. So anything that goes through our body, any toxins we're exposed to, have to be filtered through the kidneys, and that is, some of the risk factors for kidney cancer is being exposed to toxins or industrial byproducts or even asbestos. So I think partly that, but also the thing that increases the risk the most is smoking. So smoking actually doubles your risk of developing kidney cancer, and again, it's filtering the toxins in cigarettes through the body.
Yeah, and I guess most people are thinking lung cancer, when they're thinking of smoking and not kidney cancer. So that's a really good thing for people to look out for. And while we're still on the pathophysiology of kidney cancer, what are the survival rates and the severity of it? We know like breast cancer can, have some pretty good long-term outcomes. Yet if we compare that to something like ovarian cancer, we know the long-term rates of survival with ovarian cancer are quite low. What's kidney cancer doing as far as that goes?
It depends a lot on when it's picked up. So if it's picked up early and while it's still contained within the kidney, then surgery is generally what's recommended. And so if you're able to, when they do surgery, depending on how large the cancer is, they'll either take out the entire kidney or they'll take out part of the kidney. So if you're able to have surgery and it's diagnosed at that stage, then outcomes are definitely better. And then, it depends. So renal cell carcinoma is the most common of all of the kidney cancers. There are different types of kidney cancers. And so again, survival depends also on the type of cancer. The thing with kidney cancer, which is a bit different to other cancers, is that generally it doesn't really respond very well to chemotherapy. So chemotherapy is not often used, certainly not in renal cell carcinoma. It may be used in some of the other types of kidney cancer. But surgery is always sort of the first port of call, and then immunotherapy or targeted therapies are used more often.
Yeah, that makes sense. So let's go through the different types of renal cancers, or kidney cancer. So we obviously have renal cell carcinoma being the most common. What other cancers potentially will affect different cells of the kidneys and location?
So renal cell carcinoma is the most common. So that's about 80 to 90% of all kidney cancers. Definitely the highest. Then urothelial carcinoma. So that's about 5 to 10%. And urothelial carcinomas, while it's classified as a type of kidney cancer, it's also very similar to bladder cancer. So it's actually treated more like a bladder cancer than a kidney cancer. Then you can have sarcoma of the kidney, which is quite rare, and Wilms tumor. And Wilms tumor is what you'll most commonly see in children with kidney cancer. And that's only about 1% of childhood cancers.
And with Wilms, is that more genetic than environmental?
Yeah, I think so. It's quite rare, but yeah, more along the genetic lines.
Yeah. So we'll talk mostly about renal cell carcinoma. So let's just go into the pathophysiology of that. So Apollo can't help himself, but he loves to be on camera and say hello to everybody. So if we're talking about renal cell carcinoma, let's just go through location of the cells and how that changes and affects kidney function.
Yeah, so basically with any of the kidney cancers, it's going to affect the structure of the kidney. So renal cell carcinoma usually starts in the proximal tubule in the kidney, and they're the part that transports urine. Depending on, I guess, how progressed it is, what it does is it basically takes over from the kidney tissue. So that's why you can see a reduction in GFR. So it may be that someone's picked up that there's something going on because their kidney function has reduced. And then depending on, as it gets larger, again, it takes over more of that kidney tissue. And so then similar to kidney disease, your kidneys that have trouble filtrating, got the buildup of wastes, and then similar, and which is why a lot of the symptoms are similar, like the blood in the urine and fatigue and weight loss. They're also symptoms of chronic kidney disease.
Yeah, that totally makes sense. So sounds like Western medicine, as we know, chemotherapy isn't very useful in any of the different kidney cancers, but renal cell carcinoma being the most common. So they're obviously using immunotherapy, target cell therapy. What are the long-term outcomes of kidney disease? Are those things generally quite effective? Obviously, early stages, if they can remove and do, obviously it's one kidney, so people live, we know, quite well with one kidney. So, does that all help with survival rates and those sort of things? Or is it a cancer that is going to be likely to metastasize? Being that it's in the renal tubule, does that end up in the bladder and bladder cancer? I mean, it's filtering, so I wouldn't think it's too close to your lymphatic nodes to be able to be more of a metastatic type cancer, but I don't actually know a lot about renal cell carcinoma and its ability to spread and metastasize.
Yeah. So it can spread and metastasize. So I guess more commonly to the lungs, that would, probably be the primary place, but also can spread to the lymph nodes, bones, liver would probably be the other sort of more common places. In terms of treatment, having surgery, generally is the best option if that's an option for you, because obviously we're removing the cancer and then it's more about sort of mopping up anything that might be left over. Survival rates are generally better if we're able to do that. But the things like the targeted therapy and the immunotherapies are quite well, I guess with some cancers, we're not quite there yet with some targeted therapies and immunotherapy, but for kidney cancer, they can be, quite effective, and have people, go into remission for a long time. Like any cancer, there's always the potential for it to come back. That's where I sort of come in with, changing things like diet and lifestyle and all of those things that might have helped to allow the cancer to start in the first place.
And let's talk about that. So if someone was coming in to see you and they said, Emily, I've been diagnosed with renal cell carcinoma, I'm doing some targeted therapy, I'm really hopeful that long-term, sorry, this dog's got this bone right next to me. I'm really hopeful that long-term that will be really useful. What diet and lifestyle advice and potentially supplementation and treatment would you be implementing for that person, and and how do you see that go, and do you see that people have long-term really great changes without metastases and cancers coming back?
So I guess the way I usually explain it to my clients is who have cancer, that think of the body as a garden bed. And so, we've got this cancer, so we've got these weeds growing in the body. We can go in and we can cut them out. We can use, herbicides and pesticides, and we can poison them and get rid of them. But if we're not actually changing the terrain of the soil, so the soil that allowed the weed to grow in the first place, then how can we expect that the weeds aren't just going to come back after we've gotten rid of them? And so that's sort of similar to the body. So, cancers develop for a range of different reasons. There's a range of different things going in the body to allow that to happen. And we need to, I guess, sort of identify what those could be and target them, change the terrain of the body so that we're less likely to have these weeds grow back. And I guess when I'm talking about the terrain of the body, obviously I'm talking about, diet and lifestyle and stress, but also particularly looking at some of the things that we know drive on cancer. So inflammation is a really big one. Oxidative stress is another one. our immune system, so how well our immune system is functioning, because part of our immune system's role is to identify cancer cells in the body and get rid of them. And obviously, if that isn't happening, there's something going on there. And then also blood sugar regulation is a really important one. So we know that most cancers will preferentially use glucose for energy. And that's part of the reason why people with diabetes are at such higher risk of cancer. So we also want to sort of manage blood sugar as well. So I guess they're the kind of key areas that I'm always thinking about. If someone's going through active treatment, so they're having, whether it be immunotherapy or targeted therapy, I guess the most important thing that I want to say here is that to get qualified health advice from someone if you're going to be taking supplements. I think, there sometimes a bit of a belief that natural medicines, being natural, are inherently safe, but alongside certain medications, and particularly alongside chemotherapy or targeted therapy, they can actually interact. So just be really careful about where you're getting your information from if you're going to be taking supplements at the same time.
And run me through what type of dietary changes you would be making with someone, because it's obviously going to be, well, maybe it's not. I know I treat cancers very differently to kidney disease as far as the diet that I implement, because obviously I'm going for, exactly as you mentioned, blood sugar regulation being my, key priority. And I also often use ketogenic diets in cancers. Walk me through what you do with, say, a renal cell carcinoma and dietary changes.
Yeah. So with renal cell carcinoma, with all kidney cancers, actually, when they've sort of done studies, you sort of want to be looking more at a sort of, I guess, Mediterranean type diet, so low carbohydrate type diet. Not dissimilar, I wouldn't say, to a diet for someone with kidney disease, where you want, high levels of antioxidants, high levels of anti-inflammatory nutrients. But for kidney cancer, ketogenic diet actually makes outcomes worse. So that's probably the one. Yeah, when they've studied it over all of the different cancers, ketogenic diet isn't a good one for kidney cancer. So,
For the protein intake, same as normal kidney?
Yeah, I think so. It wasn't really clear exactly why. And I'm not sure if it's, again, for proper functioning of the kidney, we want an alkaline diet. So whether it's to do with that. So yeah, actually quite similar really to someone with kidney disease. So again, I'd be pulling out things like dairy, red meat, any of those really highly inflammatory sort of type foods. And yeah, focusing more on the sort of antioxidants, fruit and veggies, but again, monitoring blood sugar. So I often get people to, even if they're not diabetic, but they have cancer, to measure their blood sugar 1 or 2 hours after fasting and 1 or 2 hours after eating, for a couple of weeks, so we can sort of see, what sort of diet for them is going to be best for their blood sugar. Because again, there can be sort of, sometimes someone will strangely spike their blood sugar to something that you would never expect. So I generally will get them to do that so that we can sort of really become quite targeted with what they're eating and how that they can manage blood sugar regulation.
And would you say that people having an insulin or glucose spike to a food that on paper shouldn't cause that is due to a food allergy and it's an inflammatory reaction, and so it's working via those pathways?
Yeah, possibly. I think as well, sometimes it's hard to tell because we do need to take into account things like stress and the effect that has on blood sugar as well, and, other parts of, I guess, of their life. But yeah, potentially more inflammatory type reaction. Yep.
Okay. And so you've now changed their diet. Tell me what you're doing with, and again, I want to stress to everybody listening to this in our community that we treat people as individuals, not diseases. So it's not you've got renal cancer, you must take these supplements. But what are the type of supplements that you might be thinking of implementing for someone that has renal cell carcinoma, as an example?
Yeah, so I use a lot of turmeric or curcumin with my my patients who have cancer, because it acts on so many of the different pathways that are upregulated in cancer. So sort of, as I said at the beginning, you know, cancer is a tricky little thing, and then it will sort of co-opt the rest of your body and start to turn on and off different genes and switch on and off different proteins to try to help it to grow and divide. So there's been about, I think last time I looked, there was about 5,000 papers on the use of turmeric with cancer. So it's probably one of the most studied of all of our natural medicines, but it's able to target a lot of these different pathways. The thing with whether it be chemotherapy or targeted therapy, that it's generally only targeting, you know, one pathway, or I guess one area that cancer can use to grow and divide, whereas turmeric targets actually the majority of them, and even targets a lot of pathways that we don't yet have any chemotherapies or targeted therapies against. So that's one that I use a lot of. Probably something else is vitamin D. So vitamin D levels are really important. They've been shown to be protective against most cancers, including kidney cancer. So people with lower levels of vitamin D are at higher risk of developing kidney cancer, and it's also really important for our immune system and has its own actions against cancer. Then sort of focusing a bit more on the immune system, then I often bring in some medicinal mushrooms. So they're fantastic at upregulating our own body's immune system. They can help to increase something called natural killer cells. So cancers have all of these little ways of hiding against the body's immune system. One of the ways they do this is by removing the receptors on their cells so that they can't be identified. But natural killer cells are really the only white blood cells that can still identify cancer, even when they're sort of hiding from the immune system. So I'll often use those. And then I also use astragalus, and that sort of has a three-pronged approach, I guess, in terms of kidney cancer. We know it's really protective for the kidneys. And we know that it's beneficial in terms of kidney function. It also has good actions on the immune system, so it can upregulate, again, our immune system, while also having some actions against cancer directly. So reducing the growth or proliferation of cancer cells, and helping with what's called apoptosis, or death of cancer cells as well. Yeah, so they're probably, I guess, my primary things that I would use, sort of something similar for most people, obviously depending on, you know, what other treatment they were having and any medications that they were on.
Yeah. And it's those, some of those favorites, but again, it'll always be, you'll be coming down to doing individualized, targeted sort of stuff. With the medicinal mushrooms, are there any in particular you like to use? Is it shiitake, reishi, turkey tail, or is it all of those mushrooms will have that effect on the natural killer cells?
Yeah, I particularly use or like to use reishi, shiitake, turkey tail. But I mean, all medicinal mushrooms are going to be beneficial for the immune system. And also the other thing I do is get my clients to eat mushrooms as well. So, and, you know, as many different varieties as they can, because they're also going to be having an effect too.
Yeah. Perfect. And are there any other superfoods that you like to implement into the diet that, you know, I mean, obviously you're putting turmeric, but I'm assuming you ask people to add it as a spice to cook with it and things like that. Are there any other superfoods that people could be implementing into the diet that would be really useful with the diagnosis of renal cell carcinoma or any cancer?
Yeah. So really a lot of your herbs and spices. So they're mostly all really highly antioxidant and anti-inflammatory, and they're two sort of key areas that we want to be focusing on. Also, green tea is another good one for people to add in. So green tea, and particularly the EGCG in green tea, has been studied quite a lot in cancer, and including in kidney cancer, and it's got its own anti-cancer benefits. So if you like green tea, get drinking. But yeah, so, and also in terms of blood sugar regulation as well, to help with that, as well as being antioxidant, I also use a lot of cinnamon.
Yep. Yeah, they've done some good studies on cinnamon, actually. I was looking at some of those the other day. So it's often an overlooked spice. And of course, cinnamon tastes delicious. So, well, for most people, unless you like me, I'm allergic to cinnamon. So, but otherwise, cinnamon is fantastic. Okay, and what about lifestyle? So we know, say, exercise increases the efficacy of chemotherapy. That's something we definitely know. And I often scratch my head and wonder why more people aren't, especially oncologists, aren't encouraging their patients to exercise. Because I think the study I saw was that exercise improved the outcomes of chemotherapy by about 40%. It was high. So lifestyle wise, I know we're obviously not doing chemotherapy with renal cell. What sort of advice are you giving to people of things that they can implement into their lifestyle that we know will have a really positive effect?
Yeah, so definitely exercise is a big one.
Yeah.
Managing stress, I think, is really important. You know, we all have a lot of stress in our life as it is, and then add a cancer diagnosis on top of that. You know, there again, we know from the research that high levels of stress helped, you know, one of those things that can happen for cancer sort of to begin or to continue to grow and divide. So definitely doing something that they're managing their stress levels. I also will often get people to do some intermittent fasting. Appropriate. There's a lot of research, and sort of we're seeing more and more onto the benefits of intermittent fasting in people with cancer. And then, you know, being that kidney cancer is something that develops as well because of toxins. The other thing is, you know, having people start to reduce the toxins that they're exposed to in, you know, in their house, in their world. And obviously we can't get away from it completely. We're always going to be exposed to some level of toxins, but it's thinking about the areas where you can start to reduce your exposure can be really important as well.
Yeah. Yeah, that's all really good advice. And I think I'm reading a great book, or reread a great book, which I get a lot of my patients to read, which is called When the Body Says No. And there's actually, you may know more about this, but there's a cancer personality type. And they call, you know, we've got personality A, personality B, and personality C. And personality C is the cancer type far more likely to develop cancer. And one of the things that they've proven in studies is that cancer patients generally have a poor ability to express their emotion. They often repress things like anger. And they tend to be people pleasers. And what I found really, really interesting in the studies that I've just been looking into, mindset, obviously I have a special interest in that, is that people that were positive all the time, so were really positive about their disease and they implemented positive thinking, had far worse outcomes in cancer than people that were negative thinkers, which is funny because one of the things that especially the personal development community often says is positive think, you know, think that you'll be okay, all of that sort of stuff. And actually the studies are showing that people that think positively had much poorer outcomes. Now, that's not to say that people should be pessimistic and sad about their cancers. It was more to do with the denial of actually how people were feeling and the not acceptance of actually where they were at with the diagnosis, and the brushing away of actually honoring where they were was what caused, and it caused the same level of stress as going through a divorce. So the denial of emotions will release those chemicals to that same degree, which I find fascinating because it is often, if people are not well versed in the personal development world and they step a toe in there, they're all told to think positively. And now we know that the long-term outcomes of thinking positively in cancer, and that's what the research was specific to, is lower. So I found that really fascinating because I hadn't come across that research before to show that. I thought positive thinking, I knew that it was a bit lopsided, but not that it actually worsened that cancer outcome. So, And I don't know whether you see in clinics, seeing that you would see a lot more cancer patients than I do, whether you see a personality type in there that you want to speak to. I know with MS, there's a definite personality type. Kidney disease, as you and I both know, got quite a personality type that you and I maybe will speak about that in another podcast. But what about cancer? Do you see a specific personality type coming through?
Yes, I do. And I find it, similar to what you've said. People who are people pleasers have a really hard time saying no. Seems to be a really big theme, and tend to put others before their own needs. So that's one of the things that, and it's great. A lot of people will identify that in themselves, and will actually tell me, I think the reason this happened was because of, I never said no, I always did what other people wanted me to do, and all these sorts of things. So they'll be able to identify that and then, work at changing that. So I think that's pretty common. And that's really interesting what you say about the positivity, because a lot of people come to me and I feel like that they are denying themselves to really feel what's going on, because they'll tell me, I'm just thinking positive, I know it's going to be okay, and anytime I have a thought that things aren't going to be okay, I distract myself, I change it. And my thing, I guess, to them is always, okay, that's fine, but you need to acknowledge the way you're feeling first, acknowledge what's going on first, and then, yes, you can start to sort of look at the positive side of it. But I think that's a really big thing that is drummed into their head maybe as well. Or I guess you read online and all those sorts of things that, you have to only think that, everything's going to be okay, or otherwise, I have people, getting worried if I start to think about the negative things that happen, does that mean I'm going to draw those into my life and that's what's going to happen? So it's this whole big.
Yeah, it is. It's fascinating. And like I say, I mean, you and I obviously have studied the similar stuff about the lopsided perceptions of thinking one way, but I hadn't read until very recently the studies to show that only positive thinking had much worse outcomes of people that were what they call negative thinkers, and that could actually really express. And I think the key is that doesn't mean you unpack and sit in your negativity of woe is me, I'm going to stay here. But it's like you mentioned, it's about feeling the emotions. Like, being diagnosed with cancer is super stressful and sad. So to be able to properly grieve and go through the process and then feel angry, you're within your rights to feel a little bit angry at the world if you're diagnosed with kidney disease, and to feel that and allow to express it. If you express emotions properly, they clear from the body. And part of the theory with cancers are that suppressed emotions also contribute to cancers because of the way they trigger the stress response. And that not expressing emotions causes a chronic stress response the same way as going through bankruptcy or losing a job or separating from a partner. It provokes exactly the same stress response. And so the denial of who we are is definitely a big part of the cancer personality, as they call it. So one of the things that had really great long-term outcomes was also doing intensive psychotherapy and helping people. And that actually reduced the amounts of metastatic cancers and people relapsing. So again, I find that fascinating, and just how powerful the mind is when we can properly utilize it and not deny who we actually are. Mm-hmm. So yeah, fascinating. Okay, so we've covered the personality type. We've got the diet, so good Mediterranean alkalizing diet. We've got some really key nutrients in there, turmeric being your favorite, the medicinal mushrooms, a bit of astragalus. Is there anything else that you think is really important if someone's been diagnosed with cancer that you'd like to get across or express to people?
I think to be able to, I guess, be your own advocate, or have someone who can be your advocate, because I run into similar problems with oncologists to what I run into with nephrologists. If someone is wanting to also use natural medicine alongside their conventional treatment, that it's not necessarily accepted.
Yeah.
And so, you know, that can be really difficult for patients. And I would never put someone in a position where they have to go against what their treatment team is saying. But for someone who really does want to use natural medicine and can see the benefits, to then be told, no, you're not allowed, can be really tricky to sort of work out, you know, what the right thing is to do. So I guess be your own advocate and just make sure that the advice that you're getting is coming from qualified sources and from people who, you know, understand cancer, understand kidney cancer, rather than what you read on the internet or what your best friend's brother's mother took for her cancer.
Yes. And especially what you mentioned, you know, kidney cancer can be quite different. Like I say, most of cancers, we're implementing something like a ketogenic diet. Of course, that doesn't work. Other thing is chemotherapy. It's shown a bit like with leukemias and lymphomas, chemotherapy is not really very good there. So in fact, it makes outcomes worse. So it's just knowing those, being able to know those sort of things and advocate for yourself. And if you have been diagnosed with kidney cancer, maybe finding someone like Emily, who, it's great that you've got a foot in both worlds. You can work with the Western team. And I know Emily actually, she hasn't mentioned, I know she's in a cardiovascular unit at the moment, but you worked in oncology for what, 5, 6+ years?
9 years, I think it was.
9 years, there you go. So Emily worked in oncology. That's why her interest comes from that, as an oncology nurse. So just having someone that can bridge that gap for you, and there are people floating around out there. I will make sure I put Emily's details in the bottom there. So even if you've been diagnosed and you just want to chat with Emily about potential nutraceuticals and herbal medicine that you can implement in there, and maybe things to talk to your oncologist about, and Emily has a whole host, and we've got a big spreadsheet with studies galore in there that Emily and I track and keep, studies that you can pass along to the oncology team. Generally, if people are open-minded enough, they'll look at it, although Emily and I both know that some of the oncologists don't tend to do that. So yeah, I think that's a really good point. So thank you, Emily. I really appreciate your expertise in this area. And yeah, make sure you hit subscribe. If you want more information about who we are at Kidney Coach, head over to www.kidneycoach.com. If you hit on the article page there's a whole pile of amazing articles there written by Emily, Duncan and myself, mostly Emily if you go to all the recent ones. And then there's a whole pile of information there about general kidney disease. But again, if you need any help, I'll pop Emily's details down below, and I'm sure she'll be happy to help you. So until next time, yeah, make sure you subscribe, give us a like if you like this information. And if there's any specific topics you want to know, make sure you add it in the comments below. All right, have a wonderful day, Emily. Thank you. And we'll talk to you next time. Bye.